The physician removes a biopsy sample of skin or subcutaneous tissue for the purpose of performing a diagnostic histopathologic study under a microscope. Skin biopsies are reported based on one of three techniques used: tangential, punch, or incisional. Tangential technique describes a biopsy performed via a sharp blade to obtain a superficial, epidermal tissue specimen that may or may not include sections of underlying dermis and does not involve a full-thickness biopsy. Punch technique involves the use of a specific punch tool to obtain a full-thickness, barrel-shaped, or columnar-shaped specimen. Simple closure, including any manipulation of the biopsy defect, is included in the performance of a punch biopsy. The incisional biopsy technique describes a biopsy utilizing a sharp blade, no punch tool, to obtain a full-thickness specimen via a wedge or vertical incision. This technique type may involve specimens of subcutaneous fat. Closure of an incisional biopsy, other than simple closure, is reported separately. The patient is positioned lying on the side or prone. With proper anesthesia administered, an incision is made over the biopsy area. Dissection is carried down within the superficial soft tissue layers, usually the subcutaneous fat to the uppermost facial layer. For deep biopsy, dissection is taken down deep within the soft tissue, such as into the facial layer or within the muscle. A portion of the tissue is excised and submitted for pathology. The area is irrigated and the incision is closed with layered sutures, staples, or stri strips. Biopsy of epididymis, needle. Biopsy of testis, needle. The needle biopsy sheath is advanced over the needle and twisted to shear off the enclosed sample and withdrawn containing the sample from the epididymis or testis. The wound may be closed by suturing. Biopsy, muscle, superficial. Deep. The physician incises the overlying skin and bluntly dissects to the suspect muscle. The muscle tissue is obtained. Bleeding is controlled and the wound is sutured in layers. The needle is withdrawn. No repair is usually necessary. Biopsy, muscle, percutaneous needle. The physician removes a sample of muscle tissue using a percutaneous needle. The physician applies a local anesthetic to the skin. The physician uses a bore needle to pierce the skin, fascia, and muscle, obtaining a sample of muscle tissue. Biopsy, bone, trocar, or needle, superficial, e.g., ilium, sternum, spinous process, ribs. Deep, e.g., vertebral body, femur. The physician places a large needle into the spinous process to obtain the sample. Different approaches are taken for vertebral biopsies, based on differing levels of vertebrae. The top three cervical vertebrae are approached from a pharyngeal or anterior approach. The lower four cervical vertebrae are approached from a lateral direction. Thoracic and lumbar vertebrae are approached from behind and to the right to avoid major arteries. Biopsy, bone, open, superficial, e.g., ilium, sternum, spinous process, ribs, trochanter of femur. Deep, e.g., humerus, ischium, femur. With the patient under general anesthesia, and placed in the appropriate position, the physician makes an incision overlying the biopsy site and carries it down through the tissue to the level of the bone being biopsied. A piece of bone tissue is removed and sent for examination. The wound is sutured closed and the patient is moved to the recovery area. Biopsy of salivary gland, needle. A needle is inserted through the skin overlying the salivary gland. The physician takes a tissue sample from the gland and withdraws the needle. Biopsy, pleura, percutaneous needle. Using a pleural biopsy needle, the physician passes the needle over the top of a rib, punctures through the chest tissues between two ribs, enters the pleural cavity and slightly punctures the surface of the lung. With the end of the needle in the chest cavity, the physician withdraws a piece of tissue. The needle is withdrawn and the puncture site covered with a bandage. The procedure is often done under radiological guidance to assure more precise placement of the needle. Biopsy, abdominal or retroperitoneal mass, percutaneous needle. Using radiological supervision, the physician locates the mass within or immediately outside the peritoneal lining of the abdominal cavity. A biopsy needle is passed into the mass, a tissue sample is removed, and the needle is withdrawn. This may be repeated several times. No incision is necessary. Biopsy of pancreas, percutaneous needle. The physician removes tissue from the pancreas. The physician passes the biopsy needle through the skin of the upper abdomen under CT guidance. Biopsy of liver, needle, percutaneous. When done for indicated purpose at time of other major procedure, the physician uses ultrasound guidance to place a hollow bore needle between the ribs on the patient's right side. Biopsy of spinal cord, percutaneous needle. The patient is placed in a spinal tap position. The affected vertebrae are located and local anesthesia is administered. A biopsy needle is inserted.